All right, and state your names, please.
Elaine Jackson.
Myron Jackson.
Hello, the Jackson family. And what was your particular conditions when you came in? We'll start ladies first.
I had problems with my left hip and my left shoulder and both my knees.
Okay, and you, sir?
My diabetes was a little bit high, and my lower back and my neck was a mess.
Okay, and you say your diabetes. What they tested your hemoglobin A1C, and it was what?
It was above 7 last time, and I went back, it was 5.8.
Okay.
After a month and a half of chiropractic.
And you were diagnosed how many years ago next month?
3.
3 years ago next month, you were diagnosed with diabetes. You've been on medication for the past 6 months, you said?
About that, yeah.
Okay, so it was progressively getting worse, you would say?
It wasn't getting better.
Wasn't getting any better, so we tried medicine, and then after a short time with chiropractic, I believe it was 12 visits is when I believe you had told me around. Look, about between a month, month and a half. We're talking 4 or 5 weeks. You came in and told me the good news that your doctor said that your hemoglobin A1C level is now at a normal level.
Right.
Great. And so I told about how long you'd had yours, and Miss Elaine, how long have you had your condition?
I've been suffering with my hip about a year.
Okay. And do you know what caused your hip problem?
I think it was my job.
Okay. And for your job, you tend to get up and down a lot and
Exactly.
climb in and out of things. So what did it feel like at its worst?
It could be a 10 plus. It could be really bad where I could not move.
Okay. And what we talked about Myron trying to get rid of his condition with medication, and the results were pretty much it was not getting any better. What have we tried with your condition?
We did the adjustments, and after the first adjustment, one of my main problems was I had trouble getting in and out of a pickup truck. And when I would try and get out of the truck, my hip would actually lock up and hurt. And after one adjustment, I could get in and out of the truck with no problem.
Okay. And so with one adjustment, did some people watching think, oh good, I can get fixed in one adjustment? What did we quickly determine and educate you about, though, is that if you're going to keep getting in and out of things, what do we need to do?
You've got to keep up with your adjustments. You've got to keep up with your practice and your exercises.
Exactly, because we can't always just think one quick fix. It takes your home exercise, as I harp on you. And describe how it affected your work, your family, your social life.
Well, I mean, it could be debilitating sometimes. Right. Just it was hard, like to move, to get around. At one time I was walking. I quit walking, but at one time I was walking, and when that hip flared up, I couldn't get out and do my walking at all.
Okay, so it prevented you from doing any exercise.
Mm-hmm.
So who referred you to your office? How did you find out about it?
A friend of mine.
Who is a current patient, correct?
Yes.
Okay, we thank her for that, Miss Margie, who's out there probably watching this at some point. And so we've discussed the results that we had. So how has chiropractic changed or improved your life?
It's dramatically changed mine. I mean, it's helped with all my problems I come here with. My hip, like I said, my hip, my shoulder, my knees. I mean, they're entirely different. My hip doesn't even bother me anymore. And actually, I have more energy than what I did before I started coming here.
Great. And you, sir?
More energy, less pain. Hoping for better numbers on diabetes.
Yeah, hoping that we make this diabetes completely gone away. And what did your doctor say if you came? You said he told you that you were doing what to his profession?
I was putting him out of business.
You putting him out of business, and because your body can't heal itself, diabetes included. Okay. And your final impression of chiropractic before you came in, what was it?
Yeah, I was scared about it. I wasn't sure what it was all about, but I would suggest it to anybody that has any problems whatsoever.
Great.
Just to come in and be checked out, you know. I mean, there's things that you wouldn't normally think that a chiropractor could help you with, but it's been proven to me.
Great.
Chiropractic helps a lot.
Great. Thank you so much for sharing.